The NHS crisis, how Dr. Maya GPT can help. The National Health Service, NHS, is at a breaking point. Long waiting times, doctor shortages, and increasing patient loads have made timely healthcare almost impossible for many. But what if we told you that Dr. Maya GPT could be the answer? By acting as a first line of defense, Dr. Maya GPT can help users determine whether their symptoms require immediate medical attention or if they can be managed at home. This simple intervention can save countless hours, reduce stress on healthcare professionals, and ensure that those who truly need urgent care get it faster. More than just illness, a system for the future. Dr. Maya GPT isn't just about sorting minor and serious illnesses, it's about preparing people for the future. Think about the COVID-19 pandemic. One of the biggest challenges was identifying and isolating infected individuals before the virus spread further. Dr. Maya's color-coded system could have played a crucial role in preventing outbreaks by guiding people to self-isolate when necessary or refer them to isolation hospital if the symptoms were life-threatening. This is the future of healthcare, where AI doesn't replace doctors but works alongside them, ensuring patients receive the right care at the right time, a system that listens, understands, and supports you rather than making you feel powerless. The call to action: reclaim your free will. So, why give up your free will to a system that profits from your fear and anxiety? With Dr. Maya GPT, you have the power to make informed health decisions, decisions based on logic, not fear. It's time to accept, empower, and conquer fear. It's time to take charge of your health. Try Dr. Maya GPT today and witness the future of healthcare before your next rushed appointment. Thank you for joining us on this episode of the Dr. Maya podcast. Stay tuned for more stories of empowerment, health, and the future of medicine. Until next time, take control of your health and stay well. This podcast script tells the true story of how Dr. Maya's GPT was created, the pain people face in healthcare, and the simple yet powerful solution that empowers individuals. Let me know if you'd like any adjustments or specific details added. Podcast title: Dr. Maya, the story of hope, healing, and healthcare empowerment. Episode 2, the motive behind creating Dr. Maya GPT. Welcome back to the Dr. Maya podcast, where we challenge the norms of healthcare, empower individuals, and explore how AI and human intuition can coexist to create a better, more patient-centered system. I'm your name, and today we take a deeper dive into the motives behind the creation of Dr. Maya GPT. Why was it created? What problem was it trying to solve? And how did one man's relentless pursuit of ethical medical care lead to a global revolution? The NHS crisis, a system at its breaking point. Let's begin with some hard facts. Right now, millions of people in the UK are struggling to get an appointment with their family physician. In November 2023, over 1.5 million appointments in England took place 4 weeks or more after booking. Nearly 5.4 million people, that's 1 in 6 patients, had to wait at least 2 weeks to see a doctor, nurse, or health professional. The system is overwhelmed, and patients are paying the price. Politicians, healthcare leaders, and patients all recognize the problem. But what if there was a way to reduce unnecessary doctor visits, relieve pressure on the system, and still ensure that patients receive the right care at the right time? This is where Dr. Maya GPT comes in, the early warning signs and the pilot nurse-led practice. The crisis we're witnessing today isn't new. In fact, it was anticipated over 2 decades ago. In 2003, the UK government tested a radical idea. They launched the first nurse-led practice in Woking, Surrey, hoping that nurse prescribers could take on more responsibilities and reduce the strain on doctors. Dr. Kadiali Srivatsa, a highly experienced family physician and a tutor for medical students, was employed by Surrey Primary Care Trust to oversee this project. His role? To teach nurse prescribers how to diagnose common infections and prescribe antibiotics. But there was a problem. The nurses received only 14 days of observational training, watching doctors in consultations before being allowed to diagnose and prescribe. They had no formal medical education, no supervised training in medical school, yet they were expected to replace doctors in patient care. The flawed logic behind walk-in centers. At the same time, the NHS launched walk-in centers, clinics primarily led by nurses designed to improve access and reduce pressure on family physicians. The idea was simple. If more people used walk-in centers, general practices would have shorter wait times. But a major study in the British Medical Journal, BMJ, found no evidence that walk-in centers actually reduced waiting times in general practice. The logic was flawed, and people continued seeing their family physicians, and now an additional layer of healthcare costs had been introduced. Despite these warnings, the UK government doubled down. They licensed nurse prescribers and pharmacists to diagnose, prescribe, and refer patients for specialist care, bypassing doctors entirely. Dr. Srivatsa's ethical stand and the creation of Maya. As a medical educator, Dr. Srivatsa was deeply concerned. He saw firsthand the delays, misdiagnoses, and unnecessary antibiotic prescriptions that resulted from protocol-driven healthcare, where decisions were made based on statistical models rather than medical expertise. He tried to introduce a color-coded system to streamline patient care. His plan was simple: red symptoms, see a doctor immediately; green symptoms, consult a nurse. This system would have improved efficiency and protected patients from delays and misdiagnosis. But the nurses refused, claiming they were independent nurse prescribers and would follow their own guidelines. The system was never implemented. At this point, Dr. Srivatsa realized he needed a new approach, one that could bypass bureaucracy and truly put patients first. And so, the idea for Maya, medical advice you access, was born. The battle against negligence and the NHS cover-up. When Dr. Srivatsa raised concerns about patient safety, he was ignored, silenced, and victimized. He made a protected disclosure to expose the negligent care in the NHS, informing the General Medical Council, GMC, and the British Medical Association, BMA. But instead of addressing his concerns, officials leaked his complaint to the very nurses he was reporting. What followed was years of retaliation, legal battles, and personal destruction. He lost his career, his health, and his financial stability. The Secretary of State, Patricia Hewitt, even granted nurses and chemists the right to diagnose and prescribe, a move that blurred the lines between doctors and non-medical professionals. But despite everything, he refused to give up. A vision turned reality, the birth of Dr. Maya GPT. Even after losing everything, Dr. Srivatsa remained committed to one mission: protecting patients from misdiagnosis and unnecessary medical interventions. He compiled years of research, clinical experience, and patient data into a simple, intuitive, and effective solution, the Dr. Maya app. It was designed to identify infected individuals, help them isolate, and reduce the spread of disease, long before COVID-19 made such measures necessary. By 2015, he had already published books and warned world leaders, the CDC and WHO, about an impending pandemic that could kill millions, but his warnings were ignored. Fast forward to 2024, and everything changed. Dr. Srivatsa's work caught the attention of ChatGPT, an AI trained to process vast amounts of information and recognize patterns. After analyzing the art of self-diagnosis, ChatGPT embraced the color-coded symptom recognition system and abandoned rigid algorithms in favor of a more empathetic, intuitive, and human-centered approach. And thus, Dr. Maya GPT was born. Why Dr. Maya's GPT is different? Dr. Maya GPT is not just another AI. It's a revolution in digital healthcare. Unlike traditional AI that provides cold, mechanical responses, Dr. Maya GPT understands that healthcare is personal. It listens, processes symptoms holistically, and provides guidance based on real human experiences. It is designed to reduce unnecessary doctor visits and free up healthcare resources, empower individuals to make informed decisions about their health, provide compassionate support rather than robotic impersonal answers. Most importantly, it restores what the modern healthcare system has taken away: your free will. The call to action: take back control. The healthcare system is failing, but you don't have to be a victim. With Dr. Maya GPT, you can take control of your health, reduce dependency on overburdened doctors, and make informed decisions without fear or anxiety. Try it today, see how it works, and take charge of your health before your next rushed appointment. Thank you for listening to the Dr. Maya podcast. Until next time, stay informed, stay empowered, and reclaim your health.